Support comes from Mosby Building Arts, installing energy-efficient windows to help lower utility bills year-round. More at callmosby.com.
From the St. Louis Public Radio Newsroom, this is The Gateway. It's Wednesday, May 7th. I'm Abby Larico. Health officials this spring are reporting cases of measles in Missouri and Illinois. Measles cases are going up, while the vaccination rates in kids go down.
1 in 5 people can get sick enough to be hospitalized, and 1 in about 1,000 kids can die from it. So it's not your usual cold.
St. Louis Public Radio's Sarah Fentem reports on who is at risk in the St. Louis region coming up on The Gateway. Yesterday, Missouri's health department announced a third confirmed case of measles in the state and an adult in New Madrid County who does not appear to have had widespread public exposure. And in the meantime, health workers are looking for people who could be at risk of developing measles after a sick person visited the St. Louis Aquarium late last month. The Missouri Department of Health and Senior Services reports an unvaccinated person from Illinois visited the aquarium and a nearby restaurant on the afternoon of April 30th. St. Louis Health Director Dr. Mati Soshwayo-Davis says the city is still piecing together who could have been exposed.
And then the state notified us as the city as soon as they could. But the history is not as easy to ascertain because this isn't a city resident.
Leaders from hospitals and health departments have reconvened a task force created during the coronavirus pandemic to discuss clinical protocols and share information. Soshwayo-Davis says because the task force is already in place, the city is in a good position to deal with measles. The local Planned Parenthood affiliate must hand over documentation of gender-affirming care treatments to Missouri Attorney General Andrew Bailey. That's what an appeals court ruled Tuesday. The Missouri Independent reports Planned Parenthood Great Rivers had been fighting the AG's probe into the use of hormones, puberty blockers, and other treatments for transgender minors provided at facilities including Planned Parenthood and a clinic at Washington University. The decision overrules previous judgments and states that HIPAA doesn't prevent Planned Parenthood Great Rivers from providing records stripped of patients' identifying information. This means the organization either has to produce records or list exemptions in response to the investigation. Planned Parenthood leadership says they're disappointed in the court's decision. St. Louis has agreed to pay a total of $4 million to people detained in its former jail known as the Workhouse. As St. Louis Public Radio's Chad Davis reports, people detained between November of 2012 and June of 2022 for 5 or more days would be eligible for compensation.
About 16,000 people could be impacted by the settlement. The exact payout will depend on how long a person was detained at the jail over those 10 years and how many people file for compensation. Detainees had complained about poor conditions at the jail for years. It was emptied in 2022 and demolition began earlier this year. Blake Strode is executive director of Arch City Defenders. He says his clients have gone through a long fight that began in 2017.
I think they are taking some solace in the fact that now the city is actually paying people for some of the harm that they suffered.
The settlement was reached under former Mayor Tashara Jones, but still needs court approval before it's finalized. I'm Chad Davis, St. Louis Public Radio.
Prosecutors will no longer recommend sentences of probation for people convicted of gun crimes in St. Louis County. The county's prosecuting attorney, Melissa Price-Smith, announced that policy change yesterday. The stricter guidelines apply to homicides, armed robberies, and shootings, even when no one is injured. The change also covers felon in possession cases.
All I can do is hope and pray that this decreases gun violence. It's the reason we're doing it. It's the reason we are taking a much stronger stance on any crime committed with a gun.
Price-Smith also announced the relaunch of the office's violent crime unit and creation of a special team of attorneys to prosecute homicides. She also reports cutting down a backlog of cases awaiting a charging decision by 45% in her first 100 days in office. The Missouri Senate voted to preserve benefits for the families of police officers who die in the line of duty. Currently, legislation that allows the families to claim a $25,000 benefit is set to expire in June. Under a bill finalized yesterday, that expiration date will be pushed to 2031, and the benefit amount will be increased to $100,000. The bill will also allow the state to pay for college tuition for first responders and their dependents if money is allocated for the program. Supporters hope the measure will encourage recruitment and retention. The bill now goes to the governor's desk. The school bus company First Student says it will lay off over 200 staffers, including bus drivers in St. Louis. STLPR's Hiba Ahmed reports.
About 137 drivers, 70 monitors, 5 mechanics, and 6 administrative staff in St. Louis will lose their jobs by June 30th, according to a WARN notice issued by First Student. The school bus company has been a part of the patchwork of transportation providers for St. Louis Public Schools this year. First Student said the layoffs are due to SLPS's decision to not renew its contract with the company for the next school year. SLPS announced in February that it had secured a 3-year contract with a new school bus provider called Zoom, which will begin to transport students in the fall. It's unclear whether the layoffs will disrupt transportation for the district that has struggled to get kids to and from school all year. The affected First Student employees' last day of work will be June 30th. I'm Hiba Ahmed, St. Louis Public Radio.
Opera Theater of St. Louis will soon have a new artistic leader. Patricia Rossett, a soprano who has sung at Opera Theater many times since the early 90s, will become the company's third ever artistic director in October. Rossett is also an accomplished director and teacher. She's led Opera Theater's programs for young artists for 6 years. Opera Theater General Director Andrew Jorgensen says Rossett's varied experience makes her the right person for the job.
It's really almost the sort of living embodiment of our mission that someone who has had this kind of success is now in the position to curate and to pass on this kind of knowledge.
Opera Theater launches its 50th season later this month. A new collaboration among St. Louis arts groups will bring buskers and other street performers to the City Foundry in Midtown. St. Louis Public Radio's Jeremy Goodwin has details.
The event is dubbed Live Art Mart, and it'll happen on 6 Wednesday evenings at City Foundry. Graffiti artists working with the group Paint Louis will do live demonstrations. Musicians from Producer Mastermind's Artist Development Program will perform, and organizers are looking for dancers, poets, and other performers who'd like to participate. Visual artist Norm Forever sees the Live Art Mart as a new way to meet people and promote her work.
St. Louis is a city that really appreciates public art. I think that the artists involved, that this is just an important opportunity for them to be able to push their careers further and connect with people in that way.
The first Live Art Mart will happen May 21st. I'm Jeremy Goodwin, St. Louis Public Radio.
Cases of measles, the viral infection that can be life-threatening, have exploded across the country this year, particularly in areas with low vaccination rates. St. Louis Public Radio's Sarah Fentem reports Missouri and southern Illinois have seen a handful of cases this year, but the risk is growing as vaccination rates fall.
Dr. Marisol Schweyo-Davis heads up the St. Louis Department of Health. She's watched warily as the number of people with measles rises across the country. 700 cases, 900 cases, 935 cases. Almost all of those reported this year are in people who have not been vaccinated or whose vaccination status is unknown.
I do not want us to be in a situation where we drop below herd immunity and start to see some of the levels of really fast transmission that you saw in Texas.
Starting in late April, the local cases started to appear. A few in southern Illinois, a couple in southern Missouri, one in a visitor to the St. Louis Aquarium. Schweyo-Davis says the city has one of the lowest vaccination rates in the state, and it's not where she wants it to be.
Absolutely not. I believe that we're seeing a trend that is going backwards.
Health officials declared measles eradicated more than 20 years ago, but the virus, which causes fever, cough, watery eyes, and the trademark late-stage red rash, is now making a comeback. Usually kids get the first dose of the measles vaccine at age 1 and the second around 5. But the measles vaccination rate among Missouri kindergarten students has dropped statewide, not just in St. Louis. And that decrease in vaccinations means school nurses are on high alert.
Okay, go ahead and hold that ice pack on your eye.
Megan Lozano is the president of the St. Louis Suburban School Nurses Association. She works at Clark Elementary School in Webster Groves.
All right, keep that ice pack on for a little while and we'll see how it goes.
It is the most highly infectious and contagious illness that we have out there is that 9 out of 10 people who are susceptible to it that are not vaccinated, that are exposed, are going to become infected with measles. That's why it can spread like wildfire.
She's not too worried about Webster Grove's kids. The school district has around a 97% vaccination rate, and that's enough to contain a spread. Lozano says unlike other vaccines, the MMR immunization is kind of a slam dunk.
The vaccine is highly, highly effective. So 1 dose of the MMR vaccine provides about 93% effectiveness against measles. Then if you can't get measles, then you can't transmit it, so you can't share it with others.
And that herd immunity, remember that term from the COVID pandemic, starts to wane when the measles immunization rate falls below 95%. There are parts of Missouri with pediatric vaccination rates way below that number.
We are epidemiologically absolutely at risk for measles.
That's Heidi Miller, the chief medical officer at the Missouri Department of Health and Senior Services. Miller says more parents are hesitant to vaccinate their kids because they hear distorted or incorrect information about safety and ingredients. They also could lack a regular pediatrician or think that vaccine-preventable diseases aren't that serious.
It's not like generations ago where you knew someone or you had been paralyzed by polio and would do anything in the world to prevent your child from getting polio.
But Miller says for an unvaccinated kid, measles is serious. Before the vaccine was introduced, children regularly died after they got sick.
1 in 5 people can get sick enough to be hospitalized, and 1 in about 1,000 kids can die from it. So it's not your usual cold.
Miller, Slushwyo Davis, and other health officials are making sure local clinics and hospitals know what to do when a person tests positive for measles. That means making sure everyone's up to date on CDC guidelines for isolation requirements and reporting cases to the state. It also means listening to patients' concerns about their kids and letting them know it's not too late to get them vaccinated. I'm Sarah Fentem, St. Louis Public Radio.
Tracy Tong edited that piece. The Gateway is a production of St. Louis Public Radio, a listener-supported service of the University of Missouri-St. Louis. Music by Ryan McNeely of Adult Fur. I'm Abby Larico, and from the St. Louis Public Radio newsroom, this has been The Gateway.